We can all think of moments in life when it's important to have a good team on your side. When caring for your heart, Texas Health Heart and Vascular specialists take a team-based approach to advanced heart failure so patients can focus on healing. We have just such a team here with us this morning. Dr. Alpesh Amin, Dr. Jawwad, Yusuf, and Dr. Leal are all cardiac care specialists with Texas Health Physicians Group. Good morning, doctors. I feel intimidated.
Good morning. Thank you for having us.
Great to have you with us this morning. Okay, Dr. Amin, I want to start with you. You are a heart failure cardiologist, and you will often be the first person that a patient who has been told they have heart failure sees. What are some of the immediate questions that people have typically?
Some of the most common questions I encounter are, what is heart failure? Why do I have it? And what can I do about it? So let's start with what is heart failure. The heart's main job is to pump nutrient-rich blood to the rest of the body. Heart failure is a condition where there's either structural disease or functional disease that prevents the heart from filling properly or pumping that blood to the rest of the body. It commonly can cause things like fatigue, shortness of breath, swelling in the legs or swelling in the belly, and all of these things can lead to impairments in doing daily activities that we all take for granted, like walking, shopping at the grocery store, or climbing up simple stairs. Second, why do I have heart failure? Some common causes of heart failure are high blood pressure, valve diseases of the heart, sometimes genetic diseases of the heart, familial diseases, sometimes exposures to certain toxins like illicit drugs or excessive alcohol. And it's important to keep those in mind because avoiding those things or treating those things can prevent heart failure. And then what can I do about heart failure? That's a common question we're asked, and I think it's important to keep in mind the old proverb of an ounce of prevention is worth a pound of cure. And I think that's very important because prevention is probably your key tool to avoiding heart failure.
So, Dr. Yusuf, you are also a cardiologist. You work with many patients experiencing heart failure. What kind of questions come up in your conversations?
So certainly, diet and medications, that's a big question that all the patients ask. But we also want to talk about prevention. Prevention is a big question. Like, okay, now I have heart failure. What can I do to prevent it to, cause more damage, or what can I do to not to have it at the first place? The second thing is we talk a lot about exercise. There is a notion out there that now I have heart failure and I should not exercise or lift heavy, which is really not so true. So there is a big discussion about exercise, keep moving, and talks about daily exercise. And obviously the capacity for every patient to exercise is going to be different and it's going to vary from patient to patient. And one of the other questions that we ask is, or the discussion that we have is advanced therapies for the patients. Now, if they have heart failure that is progressing, what are the other options, surgical options, or whatever the next stages of therapies are? So we talk about that.
So, Dr. Leal, you're a cardiothoracic surgeon. You offer therapies for people who may need additional care beyond medicine's exercise. How do you work with Dr. Amin and Dr. Yusuf?
So that's a really good question, and what we try to do at our institution is that we have a heart team approach to patients. So once medicines stop working, there's a lot of mechanical support and devices that we can do, different therapies, that they will not only extend the patient's life, but they'll also give them a better quality of life, which is very important. Some of the things that happens is that when you're in that stage and you're the patient, there's a lot of concerns, there's a lot of information, and some of the things that people are concerned are my physicians talking to each other. In our institution, with the heart team approach, we're constantly talking among ourselves, trying to figure out what the best therapy is for that individual patient.
Thank you so much for being here this morning. I think you would be a great team to be behind anybody who has an issue, a heart issue. Thank you so much.
Thank you.
For more information, call 866-767-9165 or go to thpg.org/teamheart.